Hello and welcome to episode 6 of VetPhysioLife. I am Shailen Jasani and I'm joined as always by Kim Sheeder. Hi Kim.
Hello.
How are you?
Still coughing well, but other than that I'm fine, thank you.
Is it one of those coughs, Kim, where you feel kind of relatively well in yourself but the cough sounds terrible, or are you just not feeling very well?
No, it's exactly that. Other than being a little bit more tired than I normally am, I feel absolutely fine. But whenever I cough, everyone in the room goes, "Oh gosh, are you okay?"
Yeah, fair enough. And I understand you were doing some more test drives this morning. So have you found a car as yet, or?
Yes, I'm very, very relieved and very happy to say that I have found myself a car. So I'm picking up a Mitsubishi Outlander SEV, which is hybrid and has 0 road tax and things like that, so it's all very good. So
Oh, very
I feel
nice.
like I'm doing my bit for the planet as well.
Yeah, so hybrid is what, part electric and part?
Yes, part electric, part petrol, and this one's a plug-in electric as well, so it's quite nice. So yeah, it's very good.
Because we're going off on a tangent here, but there are a few more electric points around, aren't they, nowadays than there used to be? So
yeah, and especially in central London, I see quite a lot. So I'm hoping that I'll be able to charge while I'm treating. That'll be all good.
Yeah, fantastic. Okay, cool. Well, look, today I wanted to focus on a specific topic that's sadly, I think, quite common amongst dogs and cats, and we'll talk a little bit more about, cats as well. And that was on osteoarthritis, or I think what some people just refer to as arthritis. Mm-hmm. So I guess if you could just give us a little bit of a summary of essentially what it is.
Yeah, so, sorry. So arthritis or osteoarthritis is, at its most basic, is wear and tear on the joints. So it's a joint disease. So it can affect any of the joints in the spine. Sorry, in the skeleton was the word I was meant to be saying there. Any of the joints in the skeleton, and it is so every single joint has got a layer of cartilage, which is a special type of cartilage called articular cartilage, which is really, really smooth and has very, very low levels of friction in it. And what happens with arthritis is that cartilage, for some reason or another, it may just be overuse, or it may be they've had an operation that has affected the joint, or it may be they've had a broken bone that's broken the bone into the joint. There's various different reasons that arthritis can start. So that cartilage gets worn down and gets roughened, and then as a reaction to that, unfortunately, cartilage doesn't have a very good blood supply, or any blood supply in some cases of its own, so it doesn't heal very well. So the body tries to heal it, but what can frequently happen instead is that the bone underneath the cartilage gets harder and harder as part of a reaction to the cartilage breakdown, and then can actually start growing sort of extra bits of bone where we don't want bits of bone, and then that can lead to pain because the nice frictionless smooth movements of the joints have been disrupted, and also loss of function of the joint, because if there's bony bits where there shouldn't be bony bits, then sometimes the joint can't bend as much as it could do. So that's probably it in its simplest terms.
Cool, thank you. And is this a condition that affects humans as well as dogs and cats?
Oh yes, absolutely. Anything that's got a skeleton and has joints in it pretty much can get arthritis if they live long enough and the joints are used long enough. Yeah.
And just to be clear, so this is different to the kind of rheumatoid arthritis that people may have heard of as well?
Completely different, an entirely different process. And the only similarity between rheumatoid arthritis and osteoarthritis is that it affects joints, and that is it. There is no other similarities.
Okay, well that's cool. And in terms of dogs and cats, which we tend to focus on, then sorry, neither of us is in brilliant health. Yeah. Are there animals that are at increased risk?
So any animals that have got if they've got things like joint dysplasias, so if they've got hip dysplasia, or if they've got elbow dysplasia, which dysplasia very, very simply means that as they're growing, that joint doesn't grow correctly as you would like it to, which means that what happens is what you want two bones. Every joint has to be comprised of two bones, and it's the bit where those bones move around each other is the joint itself. But if those two bones don't fit together very well, then that is another way that you lose this ability for this nice frictionless movement, and then the body tries to correct that, and then that can end up, doesn't always, but can end up frequently as arthritis. So not necessarily specific animals that are more susceptible to it, but there are some conditions that will mean that you're more likely for arthritis to occur, I think is probably the better way of putting it.
Okay, and then in that sort of scenario, you mentioned a little bit ago about if you live long enough. So are we saying that as well as maybe some animals that have other conditions that sort of predispose them, that older animals that are at increased risk of having arthritis, or it's found more commonly in older animals?
Yeah, it's found more commonly in older animals, and yeah, in my experience, both in humans and animals, if you live to be truly old, then you're almost guaranteed that there are going to be specific joints that take a lot of use throughout your life are going to have some form of arthritis. It's how our body is. It's a part and parcel and sort of a secondary complication of how our body is trying to maintain itself, and it's almost like it's a little bit too effective in a way, and then builds this extra bone as things sort of get worn down, basically. So yeah, you're going to get it. When you get old, you're almost certainly going to get arthritis. But that doesn't mean to say that you need to stop what you're doing just because it might occur in the future, or even if you already have arthritis, you can just modify how you do it rather than stop having fun completely. So
yeah, fair enough. And Kim, does weight have any role in any of this conversation or not?
Oh, huge role. If obesity puts more force, so being overweight in any way puts more forces through the joints, which causes more wear and tear. And there's some really, really good studies in dogs that have got arthritis and have got the signs and the symptoms of arthritis, so pain, decreased movement, usually muscle wastage around the affected joint because they've stopped wanting to move that joint because it hurts when they move it. And all they've done in these research papers is get the dogs that were obese to lose just 10% of their body mass. So that is not necessarily even getting an obese dog back to being a fit, normal weight dog, potentially. They could still be overweight, but they've just lost 10% of their weight. And a massive proportion of those dogs go from being symptomatic and showing pain and signs of arthritis to becoming asymptomatic and not showing any signs of pain, becoming more active, becoming more like their usual selves. So weight loss or weight control is vitally important. And it's, if you've got a dog that has got something like, if you've been told your dog's got hip dysplasia or elbow dysplasia or any of the potential problems that might cause arthritis in the future, then keeping your dog's weight under control is by far the most important thing you can do for them.
Okay, fantastic. And let's just move on and sort of talk a little bit about how osteoarthritis is diagnosed in dogs and cats.
Well, there's a few different ways. Some of it is, so the vet themselves will have a look at, it's always diagnosed by the vet. The vet will in the first place listen to the carer and see what they're telling them. So it's usually they see possibly pain demonstrated, a limp potentially, if it's in one of the joints of the limbs. It may be that they see a lack of use of that area, so they will see muscle loss, like I said before, and they will actually feel the limb. They'll go through the joint. They may feel pain around the joint. They can feel thickening and a change of shape of the joint sometimes, depending on what's going on. They're potentially this bony growth. The extra bone usually happens around the edges of joints, so you can usually feel a thickening. The joints become more bulbous potentially. So the vets can feel that. And then the most definitive is usually by having an x-ray and having a look and seeing what the bone is actually doing within that joint and see what's happening there. But you don't have to have an x-ray in order to diagnose arthritis, but it can sometimes, it is something that is done, and it can confirm it, definitely.
Okay, so I guess what we're saying is that in most cases, it's what we would call a presumptive diagnosis, which means that, okay, we haven't taken the x-rays, but based on everything else we know about this individual animal, arthritis seems the most likely diagnosis.
Yeah, absolutely that.
And
yeah.
So what we're not doing is encouraging pet carers to want to get their sort of, especially older animals, anaesthetized to take x-rays to prove the diagnosis, because in the vast majority of cases it will be the correct diagnosis anyway.
Yeah,
right?
Absolutely. It's just really not necessary. There's also another really important point about x-ray and arthritis, and this is correlated through humans as well as animals. You talk to any vet and physio, they'll all agree, you can have a joint that on an x-ray looks absolutely terrible. It's got loads and loads of extra bone and it's really degenerative and it's really worn. And that dog and or human and or cat, whatever, can be absolutely fine and not have and barely have any symptoms, maybe a little bit of stiffness on rising of a morning, and that's about it. You can equally have an x-ray of a joint that shows barely any degeneration whatsoever. We're still happy that it's arthritis, but shows very, very little bony growth and things like this. And you can have a crippled animal or human. So the x-ray findings, although they're confirmation, they don't necessarily correlate with the severity of what you can see in that animal. And looking at the animal and treating and helping what you can see is by far more important than having a picture.
Yeah, fantastic. That's a really good point about the lack of correlation. I wanted to talk about cats, because I know we often don't talk that much about cats, but do you think that arthritis is under-recognized in cats?
Hugely so, yes. Yes, definitely. Cats are very, very tricky because they're very, very good at masking their symptoms and their problems. So an older cat will get more sleepy and you won't notice, and they'll self-modulate. So you won't necessarily notice. They're also very, very difficult cats to actually definitively say that this cat is in pain or not, because they don't like, a lot of cats don't show their pain, so they just go quiet, and you think you may not realise there's anything wrong at all, but the cat could be quite uncomfortable. You need to look for, really, as a carer, the big things to look for with cats is, and it's either older cats or it's a cat that maybe has maybe had a broken bone or something in the past, because that increases the likelihood of that they're going to get arthritis at some point. But you're looking at a decrease in activity and modifications of habits. So if, for example, they've always jumped up onto the back fence and now suddenly they're not bothering anymore. Yes, it's a sign of old age, but it could also that old age sign could be because of arthritis, and it may or may not be worth, if you're thinking, maybe them just jumping up onto the back fence is no big deal, and actually that might be a good thing because they'll stop catching birds and things. But equally, if they can't then jump up onto the sofa anymore to have a cuddle, then that's a lot more important and a lot more relevant to potentially to their quality of life, and it's a much smaller distance, so it could indicate a much severer problem. So they just go to the vet and get your cat checked if you're worried, but very tricky to see in cats, and I do think it's underdiagnosed, definitely.
Fair enough. And so speaking about going to the vets, and let's talk let's sort of end talking a little bit about the management of animals with arthritis.
Yeah.
So we talked about weight, and I'm gonna hazard a guess that weight control is one of the things you're going to talk about.
Yeah. Yeah. So management of arthritis, there's a few different things. There's weight management is by far the most important, over and above everything, I would say personally. There are non-steroidal anti-inflammatory drugs which your vet may prescribe, which can be helpful. They can be used in a number of different ways. So they're looking a bit stiff and a bit more painful today, so we'll just give a dose like we would take, if you're got a headache and you take some paracetamol, sort of an as and when, through to a regular, let's keep them on a dose to constantly to help control the pain. There's also nutraceuticals, which again your vet will advise on one way or the other. The research is pretty equivocal as to whether nutraceuticals are effective or not, but it does seem to be that possibly if any are effective, then it's the omega-3 oil concentrations that might be useful, but your vet is the best person to advise on that. And then physio does help, definitely. And there's a number of different ways we can help from a physio point of view. So while we can't do anything to the bones and the joints themselves, what we can do is make sure that the muscles around those joints are as strong as possible with varying different exercises and things and different techniques that we can use to try and keep the muscles as strong as possible. And that just helps to support the joint, which can do miraculous things as far as pain and function is concerned. It's really quite impressive. Going back to my cases, I see a lot of arthritis in older dogs. I had one that I saw 3 weeks ago, and a 14-year-old Weimaraner who was starting to decline a bit more, and I suddenly noticed as he was getting up and down, he wasn't sitting. He was going front legs down first from a stand to a lie. So I just got him with his owners doing some basic strengthening exercises of the back end, and he's already, saw him yesterday, and he's started jumping on the sofa again, and that's 3 weeks worth of exercise. So they're really happy. Obviously, the dog's really happy because he can get back on his sofa again that he's not been feeling he could do. So he's feeling more comfortable, and he's using the limbs more because of that. So exercises, and then different things like pacing techniques. So if you've got a dog with arthritis, taking it on a walk for 2 hours is going to do it no good whatsoever. Taking it on 4 walks of half an hour, it will love. Now, okay, you've got to fit that into your own lifestyle, and that is maybe a little bit too much, but short and frequent is much better than one large clump of whatever activity you're doing, whether that be a human with arthritis or a dog with arthritis. And then there's other things like you can help with pain relief, which the massage is beneficial, not only just to keep the muscles in as good a condition as possible, as I was talking about last week or last episode with trigger points, etc. But also there's been research to show that massage actually has analgesic, so pain relieving effects, and has a carryover of a few weeks. So that can be very useful if they're having regular massages. And also there was something else that's just gone straight out of my head. Massage. Oh, and heat and things like this. So heat and ice packs and working out, and that's a very individual thing per animal and even sometimes per joint on the animal as to whether that joint likes heat or ice or heat or cold better. But that's the sort of things that we can run through with physiotherapy. And when I'm there doing physio, I use my laser a lot on the arthritic joints, and I do find that has a pain relieving effect as well. So yeah, quite a lot that can be done.
That's fantastic though, because I think it's hopefully it provides some comfort to people, because obviously it can be all a little bit bleak if you've got an aging pet and they've been diagnosed or presumptively diagnosed with arthritis, and you think, it's all doom and gloom. But I guess the one thing, well, two things before we move on to the last thing, just to go back to the nutraceuticals, because what are some other examples, albeit that we know that you said that there isn't really evidence for most of it, but what just so some other words that people would recognise?
So it's the glucosamine and chondroitin are the other two that get talked about. Greenlit mussel is also talked about, but that's for its omega-3 concentrations. So yeah.
Cool. And so I wanted to just end briefly, I guess, by talking about prognosis, but really what we're saying is that there is lots that can be done to manage the condition. It's not a condition that you're going to be able to cure, but it can be managed.
Yeah, that's exactly it. Once you're never going to get rid of arthritis, or not with the current level of medical abilities anyway. And it's something you'll have to live with. But that doesn't mean to say you have to stop doing everything that's enjoyable and modify your whole life or your dog's whole life, pet's whole life. It's just you do modify, but you don't have to stop doing the fun things, I think is the important thing. Lots of people, both in my human practice and in my animal practice, will go, we've got arthritis, so we can't do that anymore. It's like, well, okay, maybe you can't do it that way anymore, but let's find a way that you can do it so you can still have that enjoyment. Because that's really, really important at the end of the day, as far as I'm concerned. If you've not got quality of life, then kind of what's the point of living, really? And I want to make sure that my patients, no matter what mammal they are, have got as good a quality of life as possible. So yeah, prognosis wise, it's never going to go away. It's never going to get better, but there's so much we can do to prolong the good quality of life.
Fantastic. Kim, I think it's been an amazing episode, and what I'm going to do is convert all this information into a blog post as well, I think, because it's too good to just keep an audio format. So that's really cool. Thank you very much, and have a great weekend.
Thank you.
Hope the cough settles down.
So do I. Thank you.
And we'll speak after the weekend, yeah?
Yeah, great. Okay then.
All right, take care, Kim. Cheers.
All right. Bye-bye.
Bye.